Okay, well, welcome everyone. Really appreciate you taking time out of your day. I think we have a very, very important topic we're going to be covering today, which is, of course, Medicare 101. Do want to let everyone know that this meeting is being recorded. And so if you want to maybe share this with a friend or someone that this might be pertinent to, we will get this approved by our compliance department, and then your advisor will be able to send this link out to you, and then you can forward on to anyone that you'd like after the fact. I think we have a great program set up for you today, but for those of you who have attended our webinars before, you'll know that I always like to do a little bit of an introduction in advance, just so you know who Cornerstone is, how we fit into the picture, and then I'll turn it over to Michael and Brandon so they can get started with their portion of the presentation. So let me just start off with, again, who is Cornerstone? And the reason I bring this up is there's a very good chance that you may not know who Cornerstone is. And the big reason for that is your advisor is independent. They may not choose to use the brand of Cornerstone. So a little bit of background on the company. We're a registered investment advisor based in St. Louis, Missouri. We were founded in 2005. We have around 120 financial advisors in 17 states. And we have a relatively young advisor population. If you look at the average age, that's 49, and industry-wide, that's about 10 years younger than the average. So, we have folks who can really help you, for a long period of time, as it pertains to your financial needs and, obviously getting in deeper into retirement and so on. But they also come with a lot of experience. At Cornerstone, we really do not hire inexperienced advisors. Our business model is really set up to bring advisors over from maybe a captive firm where they were an employee. And we've had advisors join us from 17 different firms because they wanted to be an independent financial advisor and have everything that comes along with that, but also have a partner to really run that business with them. And that's where Cornerstone comes in. As I said before, you may have never heard of Cornerstone before because your financial advisor decides to brand as something other than Cornerstone. And you'll see many of the business names, the doing business as names on the screen here. You'll see Genfinity, you'll see Planify, you'll see Symmetry, you'll see LifeMap, you'll see Triada. These are just a few of the brands that advisors have chosen to build on their own because, again, they wanted to be an independent financial advisor, build their practice, but also partner with someone like Cornerstone who can help them with running that business. All of our advisors are affiliated with LPL. LPL is our broker dealer. They allow us to provide product to solve clients' needs. They custody the assets. They generate the statements that you see. And LPL actually happens to be the largest independent broker dealer in the country with over 20,000, it's actually up to about 22,000 independent financial advisors across the country and about $1 trillion in client assets that they are managing or overseeing. Now, an important thing that you see on the screen to the bottom right-hand side is LPL has 0 proprietary products that are offered to clients. And what that means is the advisor is not put in a position where they have to really go out and use an in-house product or feel pressured to use a proprietary product to solve a need for their clients. They can really just try to go out and do what's in the best interest in any given situation to solve that need in the best way they see fit. Now, how this all comes together for you is we talked about LPL. LPL is the broker-dealer. They custody the assets. They provide the statements. They provide the product. Your independent financial advisor has decided to go independent so they can better serve your needs. But by being independent, they oftentimes have to run the business or do the business of running the business. And that's where Cornerstone can really come in to help them. We provide some of that support structure and scale that maybe they were getting from a prior firm, but it allows them to really spend more time with you. And this webinar is a great example of that. We do the planning for this. We get it through our compliance department. We help them with the marketing materials that they can just email out to you. And that takes time off of their plate and allows them just to sit down across the table and focus on your needs. So that's really how it all comes together. Now, if you do have questions for this webinar for either Brandon or Michael when they finish their presentation, The only way we can do this, unfortunately, is via email. Because we're recording this, we cannot use the Q&A or the live chat function via Zoom. So if you look down at the bottom of your screen and you see that Q&A button, do not use it. We won't be looking at any questions that come through the Q&A function. The only way for you to ask a question of Brandon or Michael is to email the email address that you see on the screen, which is cornerstonewm, all one word, no spaces, no dots, cornerstonewm@lpl.com. Those emails will come to me, and then I will convey that question on to either Michael or Brandon. So again, copy that down. Make sure that you have that ready at the end. I will certainly relay that toward the end of the webinar, but that is how Q&A will be handled for the webinar. Now, it is my pleasure to introduce our two guest speakers today. I have Michael Graham and Brandon Graham with me. They are both with Comprehensive Benefits. Michael is the president of Comprehensive Benefits. They specialize in Medicare. They have over 55 agents serving 12,000 clients in 15 states. Michael is the president of Comprehensive Benefits. He's also the author of two books. The first is Shift with Intention and SOAR, and Senior Care 2.0. Michael resides in the St. Louis area with his beautiful wife, Jennifer. Brandon is the director of operations for Comprehensive Benefits. In his current role, he's really providing educational and marketing support for all of those agents, Comprehensive Benefits. And one of the things that he has to do is really stay committed to the ongoing learning and professional development that's taking place in this ever-changing landscape of Medicare. And he regularly attends conferences and stays up to date with any of the trends that are happening in the Medicare insurance world. So two experts that we have that are going to share information on a very important topic and a very critical decision that folks have to make, when they reach a certain age. But why don't I turn things over to Michael and you can kick things off for us.
Thank you. Thanks, Bill. Yeah, and thanks for the opportunity to be here and talk with you guys about this topic, and everybody that's on the webinar that took time out to listen to this knowledge about your health insurance options as you approach your retirement age or Medicare eligibility age, and more importantly, understand that there's tons of resources out there to plug into, so you can make these decisions with confidence. Over the past couple of years, we've had the privilege of collaborating with financial advisors to help individuals create their own health insurance strategy, which it takes a strategy now to figure out what you're going to do. I found that when financial advisors and insurance professionals work together, we can put together a more comprehensive plan that not only focuses on your healthcare aspects, but your financial as well. We're an agency kind of focused on helping our clients find the best solution. There's a lot of confusion, stress, and anxiety as many people approach their Medicare eligibility. You hear the commercials, you hear you're getting thousands of pieces of mail when you are approaching 65. And for many of you, you had all this taken care of at your company with your HR department. For years, they handled all your insurance needs. Now that you're going to retire, this is the first time that you have to step out on your own and figure out your own health insurance needs. So we always like to kind of tell you, we want to be your new HR department and eliminate any of that stress, developing that process that identifies your needs. So like Bill said, collectively, our professionals and our agency have served over about 12,000 individuals, several states, primarily in Missouri and Illinois. So that's just a little bit about us. But at this point, I'm going to turn it over to Brandon, our Director of Operations, and hope you guys enjoy the presentation and find it helpful in planning out what you need to be doing. So, Brandon.
Thank you, sir. Bill, I appreciate the lovely introduction. So what I'm going to do real quick is just get our presentation pulled up. And like Mike said, we are a Medicare insurance brokerage. We service quite a few clients across Missouri, Illinois, and quite a few other markets with our broader agencies. So I'm going to go ahead and get our presentation pulled up here. Okay, and I'm sure somebody will let me know if the presentation's not being shared. But today what we're going to cover is just a little bit about Medicare, getting to know Medicare, understanding your Medicare. I know everybody on this webinar may be at a different stage. Some people may be approaching retirement, have parents approaching retirement, or there may be some folks that have been on Medicare for quite a few years. So we want to make sure that this information is helpful to folks of any of those populations. So like Bill said, if you have any questions about the presentation today, please feel free to shoot an email over and we'll make sure to respond to those as quickly as we can. So the first thing I want to touch on today is the Medicare New Handbook. This is a handbook that's mailed out by the federal government every year to individuals who are on Medicare or approaching Medicare age. So this is a great resource. I like to think of it as the encyclopedia of Medicare because it comes straight from the federal government. This is the handbook that outlines Medicare's benefits for the upcoming year. So I always like to tell folks, if you have questions about Medicare, start with the Medicare New Handbook. That's the one place where you know you're not going to get slanted information because it's coming from the federal government. The downside of the book is it was written by bureaucrats in the federal government, and it can be kind of dense and tough to understand. So our goal here at Comprehensive Benefits really is to help navigate the Medicare program and make sure our members understand their options and all of the benefits associated with them. And then today what we're going to cover, Medicare eligibility, how and when to apply for Medicare coverage, understanding some of your different Medicare insurance options once you are on Medicare, and then some helpful resources for folks approaching Medicare eligibility and who are already on Medicare. So what is Original Medicare? Well, Original Medicare is the federal health care program that's designed for individuals at least 65 years of age or with qualifying chronic conditions. So if somebody receives Social Security income disability or disability income, you can qualify for Medicare after 2 years of that qualifying disability. But for most folks, age 65 is when we first start hearing about Original Medicare and the benefits of Original Medicare. You do have to be a U.S. citizen or a legal resident of the U.S. for at least 5 consecutive years in order to qualify for Original Medicare Parts A and Part B. And I know there's a lot of talk about enrollment periods, especially on some of the television and radio commercials. Medicare has a few different enrollment periods for when folks have the ability to sign up for Original Medicare and for their Medicare insurance options. So for most folks, they'll look at signing up for Original Medicare Part A and Part B during their initial enrollment period. And that initial enrollment period takes place the 3 months prior to an individual's 65th birthday or 3 months prior to their Medicare eligibility due to disability. So that initial enrollment period is when somebody has the ability to sign up for Original Medicare Part A and Part B. And then they also have the ability to sign up for a Medicare supplement plan, Medicare Advantage plan, or their prescription drug coverage. Every year, Medicare has what's called the annual enrollment period. And this is a time of the year where people have the ability to drop, switch, or change your Medicare Advantage or Medicare prescription drug coverage. And then every year, Medicare does have what are called special election periods. These are going to be special circumstances that allow folks to make changes to their Medicare coverage throughout the year due to different circumstances. So things like moving from one county to another, loss of employer group coverage is one that we see quite a bit. or folks retiring and leaving that employer group coverage. Those tend to be special election periods that people will use to make that initial Medicare determination. And on this slide, it just kind of reiterates the importance of making sure that we're proactive with finding these benefits. You do have the 7-month window surrounding your 65th birthday to enroll in Medicare Part A and Part B. We always encourage folks to try and do so during the 3 months prior to your 65th birthday, just to make sure that there's no delay to your benefits being received. And understanding our Medicare options. So the first step of the Medicare landscape is being enrolled in Original Medicare. Original Medicare consists of 2 parts. Medicare Part A is going to be hospital coverage. So Medicare Part A covers inpatient care and hospital stays under Medicare. And then Medicare Part B is considered the medical coverage. So it covers doctor visits, outpatient care, physical therapy, any of those outpatient healthcare services. And generally speaking, Medicare covers roughly 80% of the cost associated with either hospital stays or inpatient care under Part A, or doctor visits, outpatient care under Part B. Now, in Original Medicare, there are some co-insurances, deductibles, co-payments, but overall, it's roughly an 80-20 split, 80% being picked up by the federal Medicare program and 20% left for the member. So Medicare Part A. Medicare Part A for most individuals does not carry a monthly premium. So as long as an individual has worked at least 10 years or 40 quarters and paid into that Medicare tax program, there's no premium associated with Medicare Part A. For individuals who may have not satisfied that full 10-year or 40-quarter work time frame, there is a premium associated for individuals that have between 30 and 39 quarters. That premium's $274. Less than 30 quarters is $499 monthly premium. Like I said, this is not something we encounter very often, but it is good to know if somebody hasn't been paying into that Medicare tax system, they may have a Medicare Part A premium as well as a Medicare Part B premium. And then what is Medicare Part B? So Medicare Part B is the medical side of Original Medicare. And again, it covers roughly 80% of the costs associated with outpatient visits, provider office visits, things of that nature. And Medicare Part B does typically have a monthly premium associated with it. So the standard Part B premium for 2023 is $164.90 per month. So individuals that are on both Original Medicare Part A and Part B will either have that $164.90 premium withheld from a monthly Social Security income check, or if folks aren't yet drawing Social Security, that'll be something that's paid quarterly, billed by the Department of Health and Human Services. So when we have Medicare A and B, we've got that full Original Medicare. This chart breaks down the Medicare Part B premium amounts. Medicare Part B's premium is scaled for income. So higher income earning individuals will pay what's called an income related monthly adjustment. So as you can see on the chart, individuals who filed taxes in 2021 at $97,000 or less, or filed jointly for $194,000 or less, will pay that standard Part B Medicare premium of $164.90. For income earners above that, you can see that it is scaled. This is always on a 2-year look back. So Medicare Part B bases those premiums on what we filed taxes for 2 years previously. So Medicare Part B premiums in 2023, right now they're being determined by the income tax filings for that Medicare member in 2021. This is a rolling process. So every year, Social Security is going to take a look at the tax filings from 2 years previous. So if individuals have, you know, a lot of times we'll run into it, somebody sells a business and then 2 years later they go to sign up for Medicare and, oh, wow, I have a very high Part B premium. Well, it does, you know, roll forward every year. So as that income comes off the books, it will reflect that 2 years later in that Medicare Part B premium. And again, if you're currently on Social Security, that Medicare Part B premium is just automatically withheld from the monthly Social Security income check. For somebody who's not currently drawing Social Security, you will receive a quarterly premium notice, and then you'll go ahead and submit payment to Medicare that way. How to enroll in Original Medicare. The easiest way I found to do to get enrolled in Medicare is by going to ssa.gov/Medicare, or on their website, there's a tab up top that says Medicare Sign Up Now. I tend to recommend to clients, even if we should automatically be signed up for Medicare. If somebody's not drawing Social Security, or if somebody's drawing Social Security and they're currently covered under an ACA or individual health plan that's federally sponsored, most of the time they're going to automatically receive their Medicare card for Parts A and Part B. I always recommend to folks 3 years prior, not 3 years, but 3 months prior to your 65th birthday, if our intention is to sign up for Original Medicare immediately, go to socialsecurity.gov, sign up for Original Medicare Part A and Part B. That way you know your card's in the system and on its way. You can also schedule an appointment with your local Social Security office. This tends to be the next best way to make sure your Medicare A and B are set to go effective when we're ready for them to go effective. You can also call 1-800-Medicare and opt to sign up for Medicare that way. I do recommend for folks, if you're calling into Medicare, call outside of normal business hours because they do operate with longer hours, and you can typically get through to somebody if you call after 7 p.m. So once we have Original Medicare, remember Part A and Part B of Medicare are going to roughly cover us at 80% when it comes to doctors, hospitals, physical therapy, anything outside of prescription drug coverage. And so step 2 is deciding what kind of Medicare insurance pairs well with your Original Medicare. So option 1 is to add either a Medicare supplement and a prescription drug plan, or just a Medicare prescription drug plan to your federal Medicare. The second option is to choose a Medicare Advantage plan. Medicare Advantage plans typically combine the benefits of Part A and Part B, and also most of the time will combine that Part D coverage as well. So what we're going to do is really start on the left-hand side of this graphic. And I like this graphic because it does a good job of separating out the 2 different options we have when it comes to Medicare. I'm sure with all the TV commercials, just all of the marketing that surrounds Medicare insurance, it makes it seem a lot more confusing than it really needs to be. I like this kind of an image because it really simplifies that we have 2 distinct pathways we can take when we're looking at covering our Medicare. So we're going to start on the left-hand side where it says Original Medicare and then Medicare Supplement Insurance. On this side of the Medicare picture, we're keeping our Original Medicare Part A, roughly covering us at 80% at the hospital, Part B, roughly 80% at the doctor outpatient facilities. And then we're going to look at adding a Medicare supplement policy or a Medigap policy. So how a Medigap policy works is when you go to the doctor or the hospital, you hand them your red, white, and blue Medicare card. They're going to bill the first 80% of that Medicare approved service to Original Medicare. And then they turn around and the remaining 20% that Medicare typically leaves for the member is going to be billed to that Medicare supplement insurance policy. So Medicare supplement policies are a very true insurance product. We pay a monthly premium, and then we have an agreement with the insurance carrier that anything Medicare pays their 80% on, this insurance carrier has agreed to pay the remaining 20%. That's why I like the term Medigap policy, because it speaks to exactly what that plan is doing. It's filling the gap in original Medicare. Now, when you have a Medicare supplement plan, again, it's filling the 20% gap that original Medicare leaves for the member. One thing Medicare does not offer coverage for, but does require members to cover, is prescription drug benefits. So when we do a Medicare supplement plan, we also want to make sure that we're looking at a standalone prescription drug plan to avoid any penalties and make sure that we have quality prescription drug coverage. So this is a breakdown of some of the different Medicare supplement plans or Medigap plans available in the area. And you can see the Plan G is highlighted. Right now in the industry, the Plan G and maybe the Plan N have been the most competitively priced and the highest value add when it comes to benefits that we've encountered. And how a Medicare supplement Plan G is roughly going to work. On the left-hand side, you can see, remember when I spoke about original Medicare, there are some co-insurances and some deductibles. Those are the co-insurances and deductibles in original Medicare. And you'll see in a Medicare supplement Plan G, that Plan G is just outright filling all of those deductibles and co-insurances with original Medicare, except for the Part B deductible. Every year, Medicare has a Part B deductible. This year, it's $226. So in a Medicare supplement Plan G, you've agreed to pay the Medicare Part B deductible. Once you've gone to, tends to be the first 1 or 2 doctor visits where the member will pay out of pocket cash until they meet that $226 deductible, at which point the Plan G comes in and picks up the remainder of the healthcare costs that are covered under Medicare. So it's a very true insurance. In a Plan G, you satisfy that low annual deductible, and then the supplement Plan G is just picking up the remainder of the Medicare approved healthcare costs for the rest of the year. The big difference between a Plan G and a Plan N, in a Medicare supplement Plan N, that Plan N passes along the Part B excess charges to the member. So in our experience, those Plan Ns can be a little bit lower in monthly premium, but if folks see a lot of times it's a rural provider, they may pass along a Part B excess charge. So for simplicity's sake, I like to work with the Plan G just so that we're not ever on the hook for an excess charge that I can't itemize prior to knowing that's coming through. And again, this just kind of breaks down that Medicare supplement Plan G. So in a Medicare supplement Plan G, it's going to pay the remaining 20% after we've satisfied that annual Part B deductible. Now, that Part B deductible each year is set by original Medicare, so it can change, tends to go up a little bit each year. But from 2021 to 2022, it actually did go down a little bit. So I would expect to see gradual increases in the Part B deductible, but it has never tended to be more than 3 to 6%. And then when we have original Medicare and the prescription drug side, and a Medicare supplement, we also need to look at that Medicare prescription drug plan. Medicare does require that folks take out a prescription drug plan when they first become Medicare eligible. They will penalize somebody if they've gone longer than 63 days. So anything over 3 months without credible prescription drug coverage under Medicare does qualify somebody for that penalty. Now, with the Medicare prescription drug plans, whether they are standalone, like added to a Medicare supplement, or they're built into a Medicare Advantage plan, they all have to follow the same phases. Medicare standardizes a lot of the benefits in these prescription drug plans. So every drug plan on Medicare, whether it's embedded in a Medicare Advantage plan or standalone, is going to follow these same phases. The deductible phase, some plans may waive the deductible, some may enforce the full $505 deductible. And then most of the time, folks spend the majority of their year in the initial coverage phase. So in any Medicare prescription drug plan, the majority of individuals are going to pay their set copay based on the tier that the insurance company classifies the medication. So tier 1 would be preferred brand or preferred generics, preferred brand name, and specialty drugs. For the majority of folks, they're going to spend most of their year in the initial coverage phase where they're paying a set copay based on the tier classification of that medication. When the true costs of medications, so not out-of-pocket costs from the member, but the cost for the insurance carrier and the out-of-pocket cost for the member at the pharmacy, when those reach $4,660, then an individual gets bumped into what's called the coverage gap, or a lot of folks will refer to it as the donut hole. And in the donut hole, members wind up paying a 25% co-insurance on the cost of the medication. So instead of paying that set copay based on the tier of the medication, we're just paying 25% of the cost on that medication up until a total out-of-pocket limits reached of $7,400. If somebody hits that coverage gap limit, then they move into what's considered catastrophic coverage, where the price on our medications drops drastically to 5% of the cost, or $415 for generics, or $1085 for brand name drugs, depending on what comes out to be the higher amount. So again, with Medicare prescription drug coverage, these are all standardized, but the things that make one Medicare prescription drug plan different from another may be the prescriptions that they cover. All of them are required to cover at least 3 medications for each medical condition, but drug plan A may cover 3 statins and then not cover a 4th, where drug plan B may cover the 2nd, 3rd, and 4th statin, but they may not cover that first one. So it is a good idea every year to either do a review with an agent, or by going to medicare.gov. You can actually type your prescriptions in and conduct a review. That just ensures that you're in the lowest cost prescription drug plan for your specific prescriptions for the following year. These are all very individualized, so your choice of drug plan really shouldn't be based on, oh, I want a better drug plan, so I'm going to pay more per month. It really comes down to what prescriptions do you have, and how are they going to be covered that year in that particular drug plan. And what we want to look for annually with the prescription drug plans every year during the annual enrollment period, so October 15th through December 7th, you do have the ability to review those drug plans and make a change for the following year. Every year, the tier that different medications fall into and the formularies can change. So it's always a good idea to review your drug plan, review any notices that are sent out by your prescription drug carrier. And if you notice certain things aren't covered the same way they were the year previous, it may make sense to schedule a consultation, or at least take a look at how that drug plan is covering our prescriptions. So we did just touch on the left-hand side. So the side that says original Medicare and a Medicare supplement. To really simplify, we can think of that left-hand side as being, I'm paying a monthly premium for my Medicare supplement plan on top of the monthly premium that I'm paying for my Medicare Part B. But when I go to the doctor, the hospital, I know that my only out-of-pocket costs on original Medicare approved services are that Medicare Part B deductible. So that left-hand side is more of a pay up front, whether somebody goes to the doctor 5 times a year or 50 times a year. Our out-of-pocket costs should be relatively fixed, because we know what our monthly premium is, and we know what that annual deductible is. Now we're going to take a look at the right-hand side of the picture, and this is the Medicare Advantage side of the conversation, and how Medicare Advantage differs from original Medicare and a Medicare supplement plan is, instead of when you go to the doctor, you hand them your red, white, and blue Medicare card, they bill the first 80% to Medicare. You hand them your supplement card, they turn around and bill the remaining 20% to your supplement. Well, in a Medicare Advantage plan, these Advantage plans have a contract with the federal government, with CMS, the Centers for Medicare Services. And part of that contract says that they will take that pool of money that Uncle Sam has set aside for a member's healthcare coverage under Original Medicare, and they will administer a plan that meets pretty rigorous benchmarks set by Medicare. So those benchmarks are individuals in a Medicare Advantage plan have to show that they have overall better health outcomes than somebody that's just covered under Original Medicare. They have to show a pretty high level of prescription drug adherence, pretty high level of preventative adherence, folks doing their preventative health screenings. And they also have to have a pretty high member satisfaction score. So every year these plans are rated on a star rating system. So that's another one of those things to look for in that Medicare New Handbook is, hey, what are the star ratings for the different Medicare Advantage plans in my area? One other thing that Medicare requires of these Medicare Advantage plans is that they have what's called a maximum out-of-pocket spending limit. That's really the whole idea of Medicare Advantage is we're going to try to design a plan where we don't charge a member an additional monthly premium, but we're able to put a cap on annual out-of-pocket expenses. And really, in a big picture way, the way that Medicare Advantage plans are able to take that pool of money that's set aside for 80% of a member's healthcare needs and stretch it to 100% coverage is by providing a little bit more oversight than the federal Medicare programs able to provide on Original Medicare. So in a Medicare Advantage plan, that oversight, it comes in the form of maybe having a provider network. Most Advantage plans do have a provider network. We want to make sure we're staying within in all non-emergency situations. Medicare Advantage plans also may have prior authorization. So it's something folks are pretty comfortable with coming over from the group healthcare insurance side, but I got to get this CT scan authorized from my insurance company before I go sign up for that CT scan. By providing that level of oversight that a private company is able to do, they can oftentimes lower a lot of the costs, lower copays, and they're able to add a lot of those extra benefits that we see advertised on TV and online. The dental, vision, hearing, different flex cards, gym memberships, all of those extra benefits that are being marketed are pieces of a Medicare Advantage plan. And the reason that they can offer that is they're just stretching that 80% pool of money to 100% coverage, but by providing a little bit more oversight. So a few key points on Medicare Advantage plans. I may have just touched on that a little bit earlier, but they are operated and approved by Medicare. These are private insurance carriers. They provide your A and B coverage and may charge different amounts for certain services. In Medicare Advantage plans, a lot of the times how you do pay for services is by having co-pays or co-insurances. So for example, a primary care visit may be a $0 copay, but to see a specialist, it may be a $35 copay. Many of the Medicare Advantage plans do offer extras, gym memberships, dental, vision, hearing, the flex cards, life alert style pendants. And in order to be enrolled in a Medicare Advantage plan, you do have to continue to pay that Medicare Part B premium. So that Medicare Part B premium is really not going to ever go away. That's just kind of our entrance fee to play in the Medicare arena. Every year during the open enrollment period or the annual enrollment period, you have the ability to make changes to your Medicare Advantage plan or prescription drug plan to go effective that following January. So there are a few different types of Medicare Advantage plans. We're really going to focus on HMOs and PPOs. The private fee-for-service model is not as competitive as it was about 10 years ago. Most people right now are encountering Medicare Advantage HMOs and PPOs. And the big difference in a Medicare Advantage HMO, that stands for Health Maintenance Organization, Typically, you have a network of providers, and you need to make sure you're staying within that network of providers in order to be covered for all non-emergency situations. In an emergency, regardless of what type of Medicare Advantage plan it is, they're always going to cover you in an emergency situation, whether it's in or out of network. The whole idea of Medicare Advantage is managed care. So it wouldn't make a whole lot of sense for them to disincentivize somebody from going to a provider just, in an emergency situation just because they're out of network. How an HMO differs from a PPO. In an HMO, you do have that fixed network. So in non-emergency situations, we're staying within that fixed network. And because we're agreeing to stick within a fixed network, these plans tend to have the richer benefits a lot of the times because the insurance carrier doesn't have to account for folks going in and out of network. So generally lower maximum out-of-pocket spending limit, and typically we see a little bit lower copays built into the plan. How a PPO plan differs. Medicare Advantage PPO plan does have out-of-network benefits. So you're able to see a provider either in or out of network. You may just pay a higher percentage or a higher copay when seeing a non-network provider. And then this just kind of breaks down the two different sides of that graphic that we've shown a few times, the Medicare supplement plan and a standalone prescription drug plan compared to a Medicare Advantage plan with the embedded prescription drug coverage. Again, whether it's a standalone prescription drug plan on the left-hand side, or it's a prescription drug plan that's embedded into a Medicare Advantage plan, they are standardized in benefits. So really the only differences one way or another are what medications they're covering. So on the left-hand side with the Medicare supplement, again, you are paying a higher premium because on that side, we're paying a monthly premium for not only Medicare Part B, but a monthly premium for our Medicare supplement insurance and a monthly premium for the prescription drug coverage. But in a supplement plan, you have the freedom to choose any doctor, any hospital that accepts original Medicare. So about 98% of providers right now in the US accept original Medicare. So really no network. You can see any doctor or any hospital that you prefer. There are no referrals. Some routine services aren't covered. This is the one hole on the supplemental side, is it's only covering what original Medicare covers. So original Medicare right now does not offer comprehensive dental, vision, or hearing coverage. So that may be a situation where if somebody wants that extra coverage, they need to look at like a standalone dental, vision, and hearing plan as well. And on a Medicare supplement, you're covered anywhere in the continental United States. Any Medicare accepting provider will work with your Medicare supplement plan. How Medicare Advantage differs, most of these Medicare Advantage plans have a very low or a $0 monthly premium, but how we do pay into the plan is by satisfying our copays or coinsurances. Medicare Advantage plans do have networks, so it's always a good idea. Our team is required to run somebody's providers and their medications before enrolling in a Medicare Advantage plan, just to make sure it suits not only your financial needs, but your healthcare needs as well. And Medicare Advantage plans may provide, some of that prior authorization or referrals, some of those extra layers of oversight. And then a lot of the time, the Medicare Advantage plans do include some of those extra benefits. So dental, vision, hearing, fitness memberships, over-the-counter benefits. Any of that exciting stuff that you're seeing on TV tends to be a value-added benefit included in a Medicare Advantage plan. And again, the reason they're able to do that is just by taking that pool of money and administering it in the most efficient way that they see possible. And here's another little plug for comprehensive benefits. We are a full service Medicare insurance brokerage. So we work with many of the industry leading carriers in the Midwest. We've helped over 12,000 clients as an agency, and we take compliance and agent training very seriously. We want to make sure that our agents are out there offering a diverse array of products, not just working with one product line or another. We really want to make sure that all of the folks that we work with and train and that represent us are living up to that expectation of providing exceptional client service. And a little team photo and some of our contact information. I appreciate everybody taking the time to jump on this afternoon. I will go ahead and kick it back to Bill if he has gotten any questions that we could answer. Bill?
Thank you, Brandon. That was great. First of all, I feel a lot more educated on the subject, as I'm sure all of our participants do. A few takeaways. The first one is I haven't had lunch yet, and that donut slide kind of made me hungry. That looked pretty good. The other thing, though, is how not just the benefits can change from year to year, but then also the client's needs are often changing from year to year. So, they might not be taking prescription meds this year, but they might the following year or 2 or 3 years out. So what really my takeaway from this is how integral this is to the financial planning process that a lot of our financial advisors take with their clients, and how important it is to be having this discussion, because the reality is the clients have a budget in retirement that they really have to be adhering to, and that can change over time. But this is also a very personal decision because of where they live, what their lifestyle is, how healthy they are, and so on. So again, it definitely needs to be part of the planning process for sure. I did get a couple of questions that came in, and the first one was, and I think you've already addressed this in terms of Medicare Advantage versus the straight Medicare from the government type of insurance. But the question was, if my coverage is cheaper, and in this situation, it was specifically coming from United Healthcare, if my coverage is cheaper, do I have to go on Medicare?
That's a great question. So I'm going to assume that we're talking about like an employer group coverage, because that's something I didn't touch on a whole lot. But for folks who are turning 65, if you're still covered under an employer group plan, and that plan is considered credible coverage with Medicare, that should be something your HR department can let you know of. As long as that health plan is considered credible coverage in the eyes of Medicare, you can actually delay enrollment into Medicare Part B. For most folks, it does not make sense to enroll in Medicare Part B and also stay enrolled in that employer group coverage. So without knowing the situation, I don't want to make a recommendation, but for folks in that situation, typically our advice is to delay enrollment into Medicare Part B and keep that employer group coverage until either you're ready to retire or until a dependent also reaches Medicare age.
Thank you for that. And by the way, if anyone does have a question, if you missed this at the very beginning of the webinar, the only way to ask a question is to email Cornerstone WM. Again, no periods, no spaces, no slashes, just Cornerstone WM at lpl.com. That question will come to me, and then I will ask it on your behalf. And Brandon, I think just based on the way you answered that question, this next one is probably going to be a similar question, in the sense that this is a very, very specific situational type of question, and you probably would want to know a little bit more about the circumstances. But I think again that kind of brings it back to the idea of this being part of the planning process, which, by the way, all of our advisors at Cornerstone have access to working with comprehensive benefits if that's something that makes sense for their clients. So if you are listening to this webinar, you have a very specific question about your situation, take that question to your financial advisor. They can certainly bring that or bring comprehensive benefits into the conversation. Or if there are other resources that they're aware of, they can certainly do that as well. But again, just wanted to let everyone on the call know if they had very specific questions, maybe how to get to the answer for their situation. So Brandon, this next question is, I have a long-term care policy that includes facility care and or hospice care. So I don't need additional coverage under Medicare. So what plan would be best for me? I also don't use any prescription meds at this point. So again, very circumstantial, but maybe you can kind of speak to how you would walk this person through finding what that best coverage for them would be.
So long-term care, I'm glad this was brought up, because the one place that Medicare, I mentioned dental, vision, hearing is one of the gaps in original Medicare. So is long-term care. Medicare covers, and then all the insurance products really will cover skilled nursing. They'll cover it up to, most of the time it's over 100 days or right around 100 days annually, but there's not any coverage through Medicare on long-term care. So nursing home coverage, things like that. So having long-term care coverage is very valuable in the situation where somebody needs to go into a nursing home. Now, if the long-term care coverage though is not credible Medicare insurance coverage, so I would recommend, I don't remember if you mentioned they had prescription drug coverage, but as long as that individual does have some kind of credible prescription drug coverage, either a standalone prescription drug or maybe filling through the VA or TRICARE, as long as they have credible prescription drug coverage, you don't have to take out a Medicare supplement policy. The prescription drug coverage really, even without currently taking any medications, is the one place where I would recommend, let's set up a prescription drug plan so that we're not in line for a penalty down the line when we do enroll.
All right, well, Brandon, that was the last question we had. I want to thank both you and Michael for taking time out of your day to educate not just the advisors at Cornerstone Wealth Management, but their clients as well. As I mentioned at the beginning, this will be recorded. If you found this valuable and maybe you have a friend or a family member that you think that this would be pertinent to or would help them in any way, once we get this recorded, or once we get this recording sent through our compliance department, we will then make the link available to our financial advisors. They can send it out to you, their clients, and then you can do with it as you choose. So really appreciate you taking your time today, and hope everyone enjoys their long Memorial Day weekend.
Thanks, Bill. Appreciate it.
Absolutely. Really appreciate the opportunity. You guys have a good one.
Thanks, guys.